another video for SCA candidates, people that are sitting the SCA to become general practitioners in the United Kingdom. This video is for you, and in this video I want to talk about the importance of safeguarding in your SCA consultations. In fact, safeguarding is something that you should always be considering, always be thinking about. And I want to just mention the safeguarding is a spectrum. So safeguarding is not a singular or a particular event. Safeguarding is a mentality. It's a mindset that you have to adopt. You have to make sure you've got yourself to that point where safeguarding is now your mindset. It's now your default, way of thinking in your consultations. If there is a safeguarding concern or an area where the examiner expects you to verbalize a safeguarding thought process and you don't demonstrate that, that alone can lead to a fail or a clear fail, especially in, of course, data gathering and management, depending on the importance, the significance of a missed safeguarding exploration, right? If it's something that, could eventually lead that patient, the child or adult, to significant emotional or physical harm, and you didn't explore it, or you explored it but you didn't verbalize it. Remember, in the exam, anything you don't verbalize, you don't get scored. The examiner is not a magician to know that you thought about it if you don't vocalize or verbalize it. So you have to mention it. You have to be seen thinking about safeguarding. It's a thought process, it's a mindset. Now, one thing with safeguarding is that a lot of candidates, doctors, family physicians struggle, especially, trainees, registrars could struggle when they hear the word safeguarding. They think it always has to be something humongous, something significant, something catastrophic. Someone is physically abusing someone, maybe sexual abuse, financial abuse, like serious financial abuse, domestic violence, child trafficking. They think of, really serious things. But safeguarding can be really subtle. It can be you making sure that there has been adequate consent given for a third-party consultation. It's you checking that an underage child who is sexually active is not being coerced, is not having intercourse or a relationship with an adult, for instance. So checking the age of their partner, making sure it's they're consented to be in that relationship, making sure no one is forcing them, no coercion, no form of abuse. So just checking all those things, and of course empathetically exploring it with the patient demonstrates a safeguarding thought process. And again, you need to own the data gathering, you need to own your management. So when you get to management, you then have to use that information you've gathered to then decide on the threshold whether that scenario meets the threshold for an investigation, a threshold for a safeguarding referral, or threshold for you to discuss with the safeguarding lead in your practice, in your surgery, or maybe it's not hitting the threshold for escalation, and you just feel that maybe something is going on here. Let me follow. How about I follow this person in 2 weeks, follow this person up in a month or in 3 months, and see how things are, with a very clear safety net. So sometimes the threshold, is about understanding risk thresholds, risk, stratification. Is this person at mild risk, moderate risk, high or significant risk? And then you decide whether you need to be referring immediately to safeguarding, are you thinking of child protection? And even when you mention those things to the patient, you don't have to be judgmental, because that's something else the examiner is looking at, how you discuss that with the parent or the patient or their caregiver or their partner or spouse, how you're bringing up those conversations. Are you accusatory? Are you making them become overly defensive and scared? Or are you able to maturely discuss that, the need to initiate a safeguarding referral, making it look like a normal process that has to be done or has to go through with the interest and safety of the person at heart. So the maturity, you have to own it. Remember, in the other video I talked about ownership. So if you've not watched my video on ownership of your thought process and your clinical decisions, you have to go and watch it because it's something you need to internalize and start getting used to in your SCA. I wish you all the best as you prepare for these for this examination that eventually, you know, would is very important. Obviously, something you must pass for you to become a UK general practitioner. All the best as you prepare for it.